Good evening, everybody. Happy Thursday. Once again, hope everybody is safe and sound. Hope everybody stayed safe and sound. Um, Yesterday we had a good talk on pathophysiology of this virus and how it attacks the lungs. And I'm going to address a little bit more of that today as far as the infection issue. And we're going to go in another direction. The virus, as we talked yesterday, the virus is in the air because it is coming from someone near you who is a carrier, who either is ill or may not be ill at all. In other words, no symptoms at all, and they're talking, breathing, coughing, sneezing, and that virus is coming out of them. And if you are within a certain distance from them, it is getting on you. And if you breathe in what they're breathing out, you are going to also be a carrier, and you may or may not get ill. But you will go your way, and they'll go theirs, and you'll continue to breathe. And unfortunately breathe out this virus and keep spreading it around. And we do not know why some people will just be carriers. And we don't know why some people will get it into their deep lung tissue where they will end up in a hospital on a vent. Is cunning. The virus spreads easily, and the virus kills. There's a lot of information out there. There's a lot of media attention, obviously. There's a lot of people giving their opinions on the virus, both in the mainstream media and on social media. There's so much misinformation. So a few weeks ago, I was so upset about all the information that was false about COVID-19 that I decided to do these videos. What I'm giving to you is information that is factual. I'm not trying to politicize. I'm not trying to increase confusion about it. I am a family medicine doctor in rural Georgia who's trying to keep my patient population safe. And by doing these videos, I've learned that I'm not only affecting my own patient population in our small, incredible town at the foothills of the Appalachians in Georgia, but I'm also apparently giving information to many people in this country and even outside this country. And I'm grateful for you to all watch this. But honestly, I'm just trying to give you the correct information from what we understand about this virus today. And here's what we understand. We understand that a virus spread from China to the world it is the 7th family member of the coronavirus family to infect and affect us. The previous 6 did not do as much damage. This one is. It's a virus. We have no vaccine. We have no treatment if you catch it. So we can't prevent it with vaccinations. We can't treat it, but it's here. It is affecting many of us. Many of us are walking around with it that don't know we have it. And so our government, our national government, our local governments, put restrictions on us, lifted restrictions, increased restrictions, telling us what to do. We're intelligent people. How do you stop an airborne virus, or a virus that is respiratory, that many people carry around, that is coming out of people and spreading? As an intelligent person, you know how to stop it. If there's a high chance that you're a carrier, you wear a facial covering so that it comes out and gets caught in your facial covering and doesn't infect someone else, because someone else might die. If you are not someone who will die from it and you don't spread it around, your immune system will kill it inside you and it will go away from you. The fact that government is telling us what to do, our medical experts are telling us what to do, is probably in some ways confusing the issue, because we don't like to be told what to do. I'm going to again repeat this because it's so simple. It really is. It's a virus that's spread by respiratory, that we have no vaccine, that we have no treatment, that we can stop by wearing a facial covering, a cloth facial covering. And the likelihood is, if we all do this, it goes away. When do you wear a facial covering? You wear a facial covering or cloth covering when you're within a certain distance of somebody. We've heard 6 feet, 7 feet, 13 feet. Let's say 15 feet. You're within 15 feet of somebody, you put the mask up. Carefully, without touching the mask, just the sides. And when you're away from 15 feet from somebody, let it down if you want. Don't wear it. The mask is protecting someone else from catching it from you, because there's a good chance you're a carrier if you're within a certain feet from that person. If you go to the grocery store and you're walking in the grocery store because you have to go to the grocery store, well, go and put a mask on so you protect the people that are near you. If you're online in the cash register, the person at the register is not wearing a facial mask, don't go to that person, because you're going to get close enough where you're going to catch it from them if they're the carrier. It's your choice. It is a free country. We're being told what to do, and it's confusing the issue. I'm asking you to be smart and recognize that all we have to do is just wear a facial covering and we'll stop spreading this thing around. And my patients who are over 65, my patients with lung disease, my patients with diabetes, and all the risk factors, heart disease, will stop dying. And you'll stop killing other people. We don't need to be mandated to wear facial coverings. Just do it because you recognize that if you spread it to somebody else, they may die. And if we all wear facial coverings, we will stop this virus without needing treatment. Will a vaccine come? Hopefully. Will treatment come? Hopefully. Will it absolutely? We don't know. We'll keep working for it. But we won't need it if the virus goes away, because we're wearing facial coverings, and the ones that have it are carrying it. Their immune system kills it and it doesn't spread. It really is that simple. It's really that simple. Happy Thursday, everyone. Have a great night. I look forward to talking to you again tomorrow. I'm praying for all of you. Thank you.